Good afternoon, everyone, and welcome to the Baldrige Foundation webinar, An Integrated Approach to the Journey to Excellence. As a reminder, due to the high number of participants today, everyone will be kept on mute during the presentations. If you have questions, please submit them to the moderator in the Q&A box located on your control screen. Presenters will answer questions during our panel discussions. Before we get started today, I want to take a moment to recognize our donors and members of the Mac Baldrige Society. Mac Baldrige Society members serve as trustees for the Institute for Performance Excellence, and it is their generous support that makes presentations like today's possible. Our guest presenters today from Wellstar Health System are Victoria Dunshari, the Assistant Vice President, Operations and Excellence, and Susan Thurman, Vice President, Nursing Practice and Clinical Integration. Following their presentation and questions from the audience, we will have an update from the Baldrige Enterprise to include Bob Fangmeyer, the Director of the Baldrige Performance Excellence Program at NIST, Margot Hoffman, the Vice Chair of the Alliance for Performance Excellence, and Stephanie Norling, President and CEO of Communities of Excellence 2026. And now I will turn it over to Susan to get us started.
Thank you so much, Al. Victoria and I are so excited today to co-present our journey to excellence with our integrated approach model. So some of the objectives that we'll go over today is really looking at our process development, describing our Baldrige criteria, going over the magnet model, discussing our integrated approach to performance excellence, looking at how we disseminate our learnings and findings and our opportunities of improvement. And with that, I wanted to start with just a quick introduction about Wellstar, and what you'll see on this screen today is how we deliver care across many settings. We have 12 hospitals, over 300 medical office locations, cancer centers, hospice facilities, urgent cares, health parks. But essentially what this slide is really showing is our comprehensive approach to healthcare, where our 30,000 team members across Wellstar delivers personalized care from the first moment, breath, all the way to the last breath, and ensuring that each patient gets high quality care. So this slide here shows some of our locations of our hospitals across Wellstar, and you will see we are in the metro Atlanta area. If we overlaid our other services that we provide, we would have a much broader scope across Georgia.
So I'm going to start by talking about our mission, our vision, and our values, and then showing you how they integrate with this topic that we're talking about, pursuing excellence. So as Susan said, we serve all the communities of Georgia, and we are proud to serve the communities of Georgia and beyond, because we serve patients from all over the nation, our surrounding states. And our mission is to enhance the health and the well-being of every person that we serve. Our vision is to deliver world-class healthcare to every person, every time. And as an organization that is pursuing excellence, we actually define what that means for us. And for us, that means we are on a journey to top decile performance. With that, our values are: we serve with compassion, we honor every voice, and of course, we pursue excellence. And that is why we're here today speaking to all of you. So our journey to excellence goals are to achieve the best outcomes for our patients, our workforce, and the communities that we serve. As I said, we do that by pursuing the designations that will make us role models through Magnet and Baldrige. And we have discovered that in order to be efficient in our pursuit of excellence, if we align our Baldrige and Magnet journeys together, we will be faster, we will get there quicker in delivering our promise of our mission, our vision, and our values, and our brand promise. And for us, our brand promise is more than healthcare. We pursue people care. So just a little bit about our strategy and our strategic destination. our strategic destination is to be an ecosystem of care that is powered by a digital operating model. So, in a way that organizations have traditional pillars, over the years within our strategic planning process and our long-term planning, that's a 5 to 7 year horizon, we have evaluated and improved and gone from having those strategic pillars to having what we call strategic themes, and to now what we call our 5 C's. And our 5 C's are: we celebrate our culture, we have personalized care models, we elevate our communities, we build connections, and we engage our consumers. And all that is centered around our brand promise of people care. And when we say people care, we're not just talking about the people that we serve, we're also talking about the people that serve the people we serve, our workforce. And what we transitioned from, because in the past we would have things like quality and safety as pillars, but now what we have in our last systematic cycle of evaluation, we said things like quality and safety, data insights, performance management, our physician enterprise, and the environmental and social governance, those are foundational elements that we just need to walk in the door. That's just the standard. And that's what you see in that circle around our 5 C's.
All right. So as healthcare leaders, we place high expectations on ourselves. Our patients and our families do as well. So we, Victoria and I, just started looking at some of the things that we place on ourselves as healthcare leaders. Of course, 0 patient harm. We want to be a great place to work, top decile performance, low turnover rate. You can see many more on the screen. And if you just think, and I'm sure many on the call today will also think of many, many more expectations that we're expected to deliver to our patients and families. With this, one of the things that's very important is that we look at different frameworks to help us move forward on our journey to organize and deploy processes to ensure that we're delivering on our brand promise and obtaining our goals. So this slide here may look familiar to some. And one of the things on this slide that's very important is how you mature as an organization with your culture strategy, aligning processes. And you can see on the left-hand slide, or the left-hand side of the slide, that the first part of your journey is really unorganized and everybody's going in a lot of different directions. And a lot of times you're really reacting to problems. You're deploying or focusing on activities rather than on processes. And there's a lack of clarity around those strategic initiatives. And over time, as you become more mature, what you'll find is that you start aligning the processes and you start putting things in place that's repeatable. And over time, and what our goal is to really have that integration of approaches. So not only are they repeatable, but you're also bringing in other work streams and effective units. But as Victoria and I was putting this presentation together, one of the things that we felt also applied to this slide was how we have aligned both frameworks. In the beginning, we were all over the place. We were unorganized, unstructured. And as we started looking at the frameworks and bringing them together, what we found was we started going in the right direction together, bringing in all units, all process together, and really integrated the frameworks so we could ensure that we're moving forward as an organization.
So what does that look like? Because we've said that there are actually many frameworks that are out there. And when we think about this is actually something when we answer our applications about what is our performance improvement system, our Journey to Excellence framework actually centers around these things. So when we think at the beginning, we said we are more than healthcare, we're about people care. And the most important people in our organization are those that are providing care to our community and to our patients and to our families. And we use the Great Places to Work framework to create a culture of trust, because we believe that when we have a high trust organization, that can transcend to joy. And when people are working in this joyous environment, that will actually breed innovation and make us that high performing organization. So our framework around people, when we go to that category 5 or structural empowerment within Magnet, we're centered around the Great Places to Work. For organizational excellence, we use the Baldrige framework because the Baldrige framework goes from soup to nuts across the whole organization, and we use it and gives us that criteria that we look at for performance excellence. Then when we look at clinical excellence, we know that across the organization, nurses want to work and people want to be taken care of at organizations that have been designated magnet because of what that means. So when we look at our clinical excellence in alignment and integration with our organizational excellence, we use the magnet framework. And then we say, you know, in order for us to be in order to support all these frameworks, we want to be a high reliability organization. And so we take that and high reliability organizations have high quality and safety and good metrics around that. So we take those 5 principles of high reliability organizations and we integrate them into both our frameworks and all our frameworks to make our journey work. And we know that when we do that, that will give us top decile performance as measured by Vizient, which is the largest comparator that we have for our healthcare organization. And our goal is to be top decile within the Vizient network. And then we'll know that we are working our way or arriving or sustaining our organizational journey to excellence. So what supports this is a lean management system, because all of this would not work without the tools and the guidance and the support that we get from having a lean management system and all those tools that really help us move all this work forward. Okay, so focusing on the Baldrige framework, which everybody in this community might be very familiar with, what we wanted to stress on this slide is, while we are healthcare, our sector is healthcare, this approach can be used across all sectors. For example, within our organization, we have lean consultants and lean directors, and a lot of them come from the manufacturing industry. And initially, when they come in, we start talking about Baldrige. In their head, they do the same alignment we're doing with Magnet. They do that with Shingo. So this alignment to get the organization talking and integrated and walking the same path can actually work across sectors. Although today we will be focusing on healthcare and focusing on Magnet and Baldrige.
All right, thank you, Victoria. So here what you'll see on the slide is the magnet component. So many may be familiar with this, but you will see in the boxes transformational leadership. That focuses on the quality of nursing leadership, and we want to always advance nursing practice. From a structural empowerment perspective, we want to advance the nursing work. We want to improve our community health, and we also want to develop ourselves and other nurses. Exemplary practice and professional practice is really looking at those effective models, those results-driven high-performance outcomes. And then new knowledge, innovations, and improvement, that's looking at evidence-based practice, research, what we can do differently to really drive results. All of these components work together and drive to empirical outcomes, which is really that results-driven outcome that we're looking for as an organization.
So when we put Baldrige and Magnet together, and we just want to go out there and put this disclaimer that we know that Baldrige has been going through their innovation and their changes, and the application has actually a different format for criteria. But when we're moving our organization, we use that traditional healthcare criteria for performance excellence. So those are the categories that we're going to be referring to. So when we set those 7 traditional Baldrige categories on top of the Magnet framework, this is how it looked like. So everything that's green is Magnet, everything that's teal or blue is Baldrige. So when we look at transformational leadership within Magnet, that really aligns with leadership and strategy within Baldrige. When we look at exemplary professional practice, that aligns with our customers, category 3, and with operations. When we look at structural empowerment, that aligns with workforce for Baldrige. And then when we look at measurement and knowledge management and operations, that aligns with new knowledge, innovations, and improvements for Magnet. And then, of course, the most important thing when you put this all together is those empirical outcomes for Magnet and those results for Baldrige.
And when we look at the alignment even further, what we really focused on was they're both evidence-based. It's what's best for our patients. It's what's best for our consumers. We know that we have aligned structures, processes, approaches, outcomes, that we have that one process improvement methodology for Wellstar. It's the lean management system, as well as interdisciplinary. All of this together, the why behind it, which is very important as we move forward with anything that we do, is really to improve that patient care. It engages the workforce in a different way, and it makes organizations more successful. So this is a crosswalk just to get kind of down in the details a little bit more. What you will see is the magnet model components and the Baldrige categories, which we went over just a little bit, but we also wanted to bring in some of those outcomes when we look at applications. How does that align? So you will see for the magnet model under transformational leadership, it aligns with those Baldrige categories 1 and 2, leadership and strategic planning. And then when we look at outcomes or how we want to form our application, you will see that we look at our nurse satisfaction survey, we look at our quality data, which also outlines with that Baldrige outcome 7.4 and 7.5. So we crosswalk that just to share with you. We don't have to go through every single one of them, but it is important that we understand that when we align both models.
Okay, so now what does this look like for when we go through our organization? So we're just going to just share that our organization is a Baldrige recipient. One of our facilities within our 12 hospitals, one of them has received is a Baldrige role model and a magnet role model. And then 7 of them are state level Oglethorpe role models, which is the highest award you can get in the state of Georgia. So we look at a phased approach to both these models. So if I was taking one of our markets or one of our facilities through the journey, we start with phase 1 where we're launching them. And during launch, really what we're doing with that with that facility or that hospital is we're bringing on Baldrige fellows. We've trained lots of Baldrige fellows in our organization. I don't know, Bob can tell us how many we've had total. We have had several Baldrige national examiners, and we really are rooted within the Sterling Council, which is our state level program, in having state level examiners. We believe that having examiners is how we create ambassadors within our organization of 30,000 people, of people who understand the criteria, can speak the language, and can start bringing the work forward for our performance excellence journey. At a site level, what we do as we are launching in this phase 1 is we do a collaborative assessment. And in the collaborative assessment, what happens is, we do it with the Sterling Council. We come in and they do a full assessment with just the organizational profile, but with 4 examiners. And this enables a whole facility to go through the process of being examined. And as we know, the unexamined life is not worth living. So that just starts training them for that final day when they're going for national role model by starting with this non-competitive assessment at the state level. In phase 2, which is usually like year 2 or 3, we're looking for that facility or that hospital to go for a state level competitive assessment so they get the designation of Oglethorpe. And at that time, we usually expect that we've at least trained that organization with at least 1 Baldrige fellow. They've had some exposure from examiners, and some of us are system employees that will count in that number for that facility. And we're looking to have about 30 Sterling examiners or within that facility, and scaled to size of the facility, of course. And then in phase 3, when they have achieved that state level designation, then we are putting that facility through the national test, the national submission. And what we look at in phase 3 is you're now sustaining that excellence that you have gained at the state level, and those national applications will continue your journey to improvement. We always want designation, but the journey is most important because that's what keeps us aligned with your journey with our sustained performance excellence. And now Susan is going to share what that looks like for the same facility going through magnet.
Thank you, Victoria. And you'll see on phase one for magnet, and this came directly out of the magnet manual. The first thing that you do is really you look at your eligibility, and there are eligibility criteria that you must meet. And then you really make an organizational decision to move forward. And when you do that, you're submitting your application as a commitment for your intention to move forward with your written document all the way through site visit. Now, what I will say that is very similar here that you will see as we integrate continued with our presentation today is one of the things that you'll see is that training. It's very important to ensure that we're educating training. We're focusing at that unit level with our magnet champions. So there's a lot of training going on at this time as well. And then when we move to phase two, it's that written document, which is a pretty significant written document that we have to submit. And it's really all our original work specific to that hospital or that organization. And you have to share sources of evidence. You have to share stories in written format of how you meet that criteria. And so that is very important. We do a lot of editing for that final document. And again, you'll see this is the application or submission phase. And that third phase is really focused on that site visit. Again, very similar to Baldrige, where we're getting ready for those preparations. We're getting ready for the site visit. Now for Magnet, we do post publicly that we'll have Magnet appraisers in our building so the public can join in if they want to as well. But as our magnet appraisers come into our hospitals, they really want to make sure that we've enculturated. So they'll focus on day shift, night shift, ask a lot of questions and make sure it aligns with our document. And then, of course, if we want that decision that we've moved forward as a magnet facility, but you'll see a lot of synergies here with this slide.
Okay. So what's important in this alignment is that intentional deployment. And what we have learned, and Susan and we had this as a goal in our performance improvements, in our performance management system to really have this alignment, is to make sure that we're not doing double work and we're not speaking two languages. So that when we have examiners or appraisers coming for either Baldrige or Magnet, the work that we have deployed is such that the people are saying the same thing for either framework or either examiners or appraisers. So what we have is, on the left-hand side, this shows we use SharePoint, and this is our SharePoint side for our Magnet Steering Committee. And our team that does all this Baldrige work has access to these documents and all those narratives, those stories that the Magnets team writes. And we pull those in as we're working with the facility. And what you're seeing on the right-hand side of the screen is our SharePoint site for Baldrige, where all our facilities are written, are in there. So for example, when you see the Cobb facility, if I was to click on there, you would see their state level application, you'd see their state level feedback report, and all this is accessible to every single employee, whether they're writing the application or not. Everybody can go into these playbooks of how we do our work and how we pursue excellence. And what that enables us to do is really not do double work. Right now, we're in the process of writing, like 3 applications for the different frameworks. And as we're doing it, I'm going into those Magnet stories and pulling for what has already been done for Magnet by Susan's team, so that we're never duplicating and we're making sure that our language and everything that we're doing is aligned.
All right, so this is our celebration slide. It shows our Baldrige Award winners here. I'm very proud of these organizations. And the next slide will show organizations that have achieved both Baldrige and Magnet together. And we believe that bringing both frameworks together really pulls forward to this type of work.
So we just wanted to walk through, as we are rounding off our last few minutes here, what that looks like for looking at feedback reports and learning as a learning organization. So, as I said before, we've had 7 facilities become designated at the state level and 1 at the national level. So we have a lot of feedback reports. So what we do on an annual basis, and we're lucky because we have fellows that help us do this, is we pull in the most recent feedback reports by category, and we put it up in that SharePoint site and we have this matrix of what's going on with feedback across the categories. In an executive summary, it would look something like this. So this is from a few years ago when we were at 4 recipients. We look across the categories, and at a summary level, we say, okay, we always celebrate our strengths that we get when, that come with the feedback reports, but we do focus in and zone in on those OFEs, and we say, are we learning, and where are our opportunities for deployment within our facilities, within our enterprise, and for improvement within the organization. So for example, when our flagship got their first, had their first feedback report, that's Kennestone in 2019, they had all those OFEs across, from strategy. They were getting about 4 OFEs category. When they submitted their 2020 application, you can see that there was significant improvement and drop in those OPs. That next year, when one of our facilities went over, we asterisked the places where we know that we need to zone in into how Kennestone is doing strategy and make sure that we've deployed those learnings to North Fulton, because we can see through the OPs that we had an opportunity there for some level of deployment. And this is a executive summary from like 2 years ago. So you can imagine now that we have 7 and some repeat Baldrige applications, how many feedback reports we've had, those collaborative assessments, we have feedback reports, and how we can really deploy best practices and learning across our organization and become more aligned in our performance excellence journey.
All right, so a few recommendations that we're working on around innovation. Part of our lean management system, we use a pick chart. And one of the things that we want to continue to work on is ensuring that all department leaders use the pick chart and can speak to it. And then ensuring that we're setting the right priorities to those processes and ideas that we want to move forward. As team members, any team member can submit an idea. We always want that closed loop communication to recognize that team member. And then one of our recommendations, and something we need to continue to work on, is as we move forward with our projects, that we always need to ensure that we're putting the appropriate KPIs attached to that project to ensure that we can evaluate it appropriately. And then of course, around data management, using system-wide data, and then looking at market analysis as well. And I will just round this off by a quick conclusion and just reiterate the importance of bringing both frameworks together, and that it can really foster a continuous improvement plan around all the categories that we want to move forward with: better patient outcomes, an empowered workforce, and then of course that sustainability that we look for as well.
So we really wanted to thank you for taking the time to join our webinar and be with us today. And we thought it would be fun to end with, we always work hard on these journeys. It's a lot of work to get to the point where you're celebrating. We celebrate along the way. And, Susan seems particularly good at this, celebrating their writers, celebrating their magnet champions. We celebrate our examiners when they get recognized through our Sterling Council. But this is just showing you when Paulding got their designation as for magnet, when our flagship Wellstar Kennestone got designated as a state role model, when one of our other facilities, Wellstar West Georgia, in the bottom got recognized for their Sterling and their oval state level application. And when you receive our slides, what you will find is we have a little bit of an appendix section for you that will give you more details on these things, and we'll just go through it quickly. It's going to give you a crosswalk of these 2 frameworks in detail. And we've also put in something that we know that is aligned, which is the year that the Baldrige Awards, the healthcare systems that have received both Baldrige and Magnet, and the year that they received it, and then the year they got the Magnet designations, and that's sustained excellence. And you will see on this slide that usually the year that they get Baldrige is the year they get Magnet, and then they continue their Magnet journey. All right, back to you, Al.
Thank you, Susan and Victoria. What a great presentation. We've got a number of questions here, so I'm just going to jump right into them. And the first one is, how can the Baldrige framework complement magnet recognition in healthcare organizations?
Well, I can start with that, and Victoria, please jump in as well if you would like. One of the things that we talked about today, and we really worked on aligning the principles together, but really both framework focuses on those leadership principles, the voice of the customer, how important continuous improvement is, and of course those results. And we, really that's what we're here to do every day, right? Is get those high performing results. But integrating those principles can really enhance the operational excellence model. So I don't know, Victoria, if you want to add anything to that, but we feel strongly that this is the right direction to go.
I think you did great, Susan.
Thank you.
Well, our next question is then, how can the integration of both frameworks support sustainability in achieving high performance results over time?
So I can take that. And, as you are going on this journey, when you start, and when I was talking about that collaborative assessment, we usually do when facility is at that phase one, we want top decile performance at all facilities. That's what we're going to measure. When a facility is at phase one, we know that they're between the 50th and the 50th percentile and top quartile. And as they're moving along, we know that by the time they get to their Baldrige journey, a lot of their results, majority of their results are now in that top quartile to top decile. We can't always get everything in there, and we're always working to. But what we have learned and seen is, as long as we're churning and we're doing the process, you just have to get started, because as long as the facility gets started and they're doing the work, the improvement comes. So right now we have a facility that's going through a state level collaborative. We started that prep last year, and already they are accelerating. We have a facility that had a collaborative last year. They're going through the state level overgrowth right now. And that facility went from a leapfrog B to a leapfrog A in the time that we were doing this work. So we can see just, by, some metrics and measures that we see, okay, there is really sustained improvement going on. And by the time when Wellstar Paulding, which Susan served at, when they got magnet and they're in the Baldrige, they were like a top 100 hospital. So we know that these aligned metrics and keeping the system going and keeping you sustained and not just stagnant when you get the award, but keeping you going with the journey helps you really push those metrics to that top decile level.
Okay, great. Our next question is around data. And the question is, what role do data and measurement play in both Baldrige and the magnet frameworks?
Well, I can say data. It really does drive our decision making. Both in Baldrige and magnet, data is emphasized heavily. We really have to look at that data and ensure that we're prioritizing the work in the right way, and that it aligns with our strategic initiatives, both with our nursing strategic plan and our hospital and system-wide strategic plan. So we really want to pull that data forward in decision-making to accelerate the work that we're doing. And
I'll add to what Susan is saying, because her and I have talked about this. When our facilities are going through their magnet journey, those NQI measures, they are looking at them like systematically, and we are also looking at that healthcare outcomes at 7.1. And what we started doing is just looking at them on top of each other, and we're saying, how do we deploy the way we're looking at these lag metrics to these leading metrics that they're doing upfront at the hospital level, so that we are looking at both at the same time. So data. We can't get there without these outcomes. So I totally agree with Susan. We can't get there without the outcomes. The lagging measures are important, but more important, alignment at those leading measures at the facility level with the work that people are doing on a daily basis.
Okay, great. Here's a question that I get frequently, especially when I travel to conferences. How do the 5 principles of high reliability organizations support this integrated approach?
I can jump in, and Victoria, please jump in as well. But one of the things that we do around those high reliability principles is we align it with our lean management system. So one of the things that we do across the organization is we have daily safety huddles, which is very important to us. And we bring examples around those 5 principles. So for example, we may pick deference to expertise, and we may bring something that happened the day before or the week before and frame that in that principle and share it across the hospital or the organization. And it does 2 things. One, it helps us really understand the framework, but it also helps teach and train our front line, which is very important as we always move forward to where we want to be as an organization. But that's just one example. We do it in a lot of different ways, but our safety huddles and aligning these principles are important to us.
And I'll just add, that was well said, Susan, that, you know, we have, as you can see, the first thing we showed you was our OFEs. We have a preoccupation with failure. And that starts at the high level journey and all the way down to, you know, when we look at in our safety huddles, in our safety improvement system, we call it SAFER. We celebrate when people have great catches, and we also celebrate when we have near misses. We celebrate those near misses because we are preoccupied with them because we see them as indicators of what may come down the road. So we're always looking at where are things going wrong so we can right that ship before something it actually harms or touches the patient. So that's just an example of another, you know, high reliability principle that we bring to our daily living within our organization.
Well, that probably leads into the next question here and give you a chance to expand a little bit, because a couple people have asked the sort of the same question here. I'm going to kind of meld them together, but they want to know how your lean principles are used in the organization.
Well, I can start, and Victoria, please jump in, and I'll just kind of talk about a couple of things. One thing that we do is we work on A3 thinking. So when we look at issues, problems, thoughts, ideas, we bring that data in again on that left-hand side of the A3. But we as healthcare leaders tend to, we're problem solvers. We jump in and we want to solve the problem. But we also want to pause and focus on the data and ensure that we are solving the right issue. And a lot of times what we find if we don't use that A3 thinking and pull that data in, that we're actually solving for the wrong issue. So that A3 thinking around that lean principle is important to us. We did talk about safety huddles. That's another example around those principles as well. And the last one I'll mention, and Victoria, please jump in as well, because there's others, is our visual management. So you'll see on all the units and in our strategic deployment rooms, as we call them, visual management. So we are making all of our issues, all of the work that we're doing visual, and we're aligning it back to that team member at the elbow, right, that's giving that care every day. And we want to make sure that we have that alignment and that we are making it visual, so we're all working off the same issue and moving forward together as an organization.
Great. Well done, Susan. You always are so articulate. And the only thing that I'm going to add is, you know, I think over the time, as we have become aligned and integrated, as Susan said, one thing that we've become really good at, I'm proud of us for, is just always having our documented standards, our standard work. Because when we have our standard work and we're measuring according to our standard work, when something goes wrong, we say, did we have a deviation from the standard work? Or is there something that was missed within the standard that we need to correct? And that came really from our lean transformation office, really deploying tools for us that made within our rapid improvement events, within our value stream mapping events, within our Kaizens, saying at the end of one of those events, if we're trying to prove them an process, we need to have a standard work document as part of the outcomes or part of the tools that come out of that. So now we have a very good standard work library. We have playbooks that have standard works for the big things like telemetry for patient experience. We have these playbooks that document that standard work and it's accessible to all our employees on eSource, which is our intranet that people can go through. And that's just living and breathing the lean management system and making it accessible to everybody who is from the people from our CEO all the way to the frontline staff who's taking care of the patients.
Fantastic. Well, Susan and Victoria, thank you so much. That was such a fantastic presentation, and we really appreciate you taking time to answer all of those great questions, of which there are a number of questions still unanswered. But for our audience, if you submitted a question, and you still can submit more, Victoria and Susan will get back to you after via email with an answer. And so with that, again, thank you so much for your presentations here today. And I'm going to turn to the update section of our webinar now and turn it over to Bob Fangmeyer, the director of the Baldrige program. Bob?
Thanks, Al. And my thanks and gratitude to Victoria and Susan as well. I thought that was an outstanding example of the alignment between and the value of using Baldrige at both the national and the state and regional level, along with other tools and other assessments. I want to encourage that and encourage the fact that for organizations that are just getting started, we strongly encourage you to work with your local Alliance for Performance Excellence program. It is a wonderful place to really get moving and begin to really get better and cut your teeth on this stuff before you attempt to apply for the National Baldrige Award. So to start, just my portion here, a real quick refresher on our purpose and mission. Purpose is improving quality, performance, and long-term success, really of all organizations and communities by recognizing role models, fostering the adoption of proven practices. That's through the Baldrige framework, that is through the sharing of best practices at our conference and on our website, etc. And we also really believe in fostering this nationwide ecosystem of excellence. It is a key part of how we accomplish our mission. And I want to thank all of our key partners, including the Alliance and the Foundation and Communities of Excellence, for your support in that effort. We are thrilled to have been able to announce the 2024 award recipients back in early October. This was the first award process following a major redesign, as Victoria referenced. We are really looking forward to sharing the best practices of those role model organizations at the Quest for Excellence conference. The organizations that will be highlighted are shown here. These are our newest award recipients. Alamo Colleges, City of Henderson in Nevada, Chickasaw Nation, Department of Health, Friesen Nichols, Northeast Delta Dental, and South Central Foundation. Now, you may recognize some of these names. South Central Foundation is a prior two-time recipient. They received what we have labeled best practice spotlights in 3 different areas. They did not receive the award this year, but they were a finalist and they were recognized with those 3 spotlights. 2 others, Alamo Colleges and Friesen Nichols, are also now two-time recipients. The Quest conference itself, we really encourage you to do your best to attend. It's going to be a wonderful time. It's from March 30th to April 2nd. The evening of the 30th is our award ceremony where we will honor and celebrate those new recipients. It's going to be an exciting time, the first recipients in a few years. And I know that many of these organizations, our recipients, are bringing many people because they really want to celebrate. So it's going to be a blast. We'll also have over 40 different plenary and concurrent sessions that will, of course, feature the new recipients, but it'll also feature prior award recipients as well as other speakers on key topics of interest that align to the content of the Baldrige Excellence Framework. We're also looking forward to the Foundation's Leadership Awards Luncheon on Tuesday. There are many individuals well-deserving individuals who are going to be recognized, and I hope you'll be able to be there and enjoy it with us. We also have a pre-conference workshop that is targeted at helping organizations that are sort of just getting started to learn more and understand the framework and what Baldrige can do for them. I'm sorry, I missed that slide. The award process. Now, it was referenced that there were some changes to the Baldrige Award process this past year. I mentioned it, Victoria mentioned it, and indeed that's very true. We went through a very significant transformation of the award process. And while I will share with you the changes that are happening for 2025, I want to reinforce that compared to 2024, there's not a lot changing here, really. We are still honed in on those the critical purpose of the award process, and that is to identify role models. That, of course, is what the award process is focused on. And in doing so, the criteria and the evaluation process really focus on the results that an organization has achieved. It was mentioned before, the focus on data that is so critical in Baldrige, and actually for an organization that is striving to improve and achieve higher levels of performance. That is really what the emphasis is in the revised award process, particularly at the application portion. Organizations that move on as finalists, there will be a deeper dive into the processes that the organization has used to determine and drive those various results. But the initial phase of the evaluation is really focused on the results that have been achieved. With that focus on really trying to identify role models, we've been able to streamline the criteria for the award and simplify the evaluation rubric. That said, it is important to know that the award process still ensures that it is an objective evaluation. It is very rigorous. There is a high degree of rigor to what is done, and we are confident that the organizations that are recognized are deserving to be held up as role models. That's important because it really is critical that those that we highlight are deserving. Now, I want to reference something here. Victoria made reference to the fact that Wellstar leverages both the Georgia Oglethorpe Award, which is their local alliance program, and the Baldrige award process. And she noted that there had been some changes too. I want to be clear on something here. Yes, the award criteria have changed dramatically. Victoria mentioned that they still use the framework, the healthcare version of the framework, for their purposes. That is exactly right. That is exactly what should be done. The framework remains as our core document, our core sort of source of content for the award criteria, as well as other offerings. So don't think that the changes to the award process and the simplification of the award criteria mean that the framework is going away. Far from it. There is still a key learning opportunity for organizations that participate in the award process. It's not the primary purpose, but there's definitely a tremendous learning opportunity for organizations that go through, both in responding to the criteria and in the evaluation report that they receive following that evaluation. So what is changing? Really, it's mostly tweaks. It is some tweaks to the criteria themselves. It is tweaks to the evaluation rubric. And largely, we are trying to make it easier for an organization to respond, easier for examiners to understand and evaluate those responses, and just add clarity to the overall process, clarity to the questions that are asked, enhance the clarity and the level, I suppose, of the guidance and the instructions that we provide. And of course, we are going to be developing and providing more samples. One of the big changes is adjusting our timeline and the calendar for the award process back to a more traditional Baldrige cycle for those who are familiar with it. In this past year, we were really pressed to make the changes to the process, implement those changes, go through the process itself, and identify role model organizations as far in advance of the recent election as possible. We wanted to be sure that we could get the attention of the administration as a part of the process, very important. So we really we had advanced the timeline significantly, and that caused some challenges, which we anticipated, quite honestly. But following feedback from all the participants, we found that there were certainly some things we needed to modify and we expected. But by and large, it's mostly tweaks to those various things that I mentioned before. So the criteria themselves for the award process, the sections, as you see here, obviously, if you're familiar with the framework, they align very, very closely to what you're familiar with. The ordering is different. The way the content is organized is different. The way the questions are presented might be a little different, but I can assure you everything in the award criteria ties directly back to the Baldrige framework. We are planning to develop a crosswalk so that individuals, organizations can see that very clearly. But I am confident that if you were to look at the criteria, you could see where it comes from in terms of the Baldrige framework. The timeline itself, I mentioned the changes to it. Here you can see those changes. We just released the criteria this week, revised criteria with a high-level outline of the evaluation process itself. January 28th, we'll open the award application. Organizations that want to participate will have until May 22nd to complete the application. With that, there are some eligibility responses that are due a little bit earlier so that we can make sure that we are able to recruit and train and plan for the evaluation of those applications by our examiners. On August 13th, the judges are going to meet and they will then determine which of the Baldrige Award applicants should become finalists. On the 14th, the finalists will have access to a portion of the application where they can complete responses that are focused on the processes that they use to drive the results that they have achieved. There are some process questions that will be asked in the application, but this is really where we ask the organizations to finalize those responses related to the processes that they used specifically for the results that they presented. And then in November, November 3rd to 7th, the judges will meet and determine which of the organizations should be recommended for the award. My final slide is a promotion, as it were, for the Baldrige Executive Fellows. Victoria mentioned the fellows several times. In Victoria, Wellstar has had 5 executives go through the fellows program, and you've hosted the fellows before, and it's been fantastic. What are the benefits for being a fellow? Well, it really can benefit you as a leader. We are looking for folks who are senior executives, C-suite types, or soon to be or near C-suite executives. The value is that you can deepen your understanding of the framework. You really get to see excellence in action by visiting various award recipients. You learn from one another, your cohort of fellows, but you also learn from and develop relationships, not just with the cohort of fellows, but also with those award recipient leaders. You have a capstone project that is used to address a strategically important opportunity for your organization. And of course, there's that opportunity for coaching and feedback and learning from other senior executives. If you might be interested, we are coming to the end of our recruitment period. It is Monday. If you might be interested, visit our website, www.nist.gov/Baldrige, and find the link for the Fellows Program. At that point, you can follow a link to submit your resume. There are a couple other minor pieces that you would need to submit to participate. But if you get your resume in by the 16th, we'll hold a spot for you to at least give the opportunity to complete the rest of the application. And with that, I will finish my remarks and turn it over to Margot, who will give an update on the Alliance.
Great. Thank you, Bob. I'm Margot Hoffman. I am the Vice Chair for the Alliance for Performance Excellence, which is my volunteer job. My daily job is I'm the President and CEO of the Partnership for Excellence, which is a member organization of the Alliance for Performance Excellence. So just a little bit about who the Alliance is and what our purpose is. We are a network of Baldrige-based programs. Our members are state and regional programs, national Baldrige programs like Communities of Excellence and ACA, and even international programs such as Sterling International. We also have other members that support performance excellence. And we've been around about 20 years. And the purpose of the Alliance is to inspire individuals, organizations, and communities to learn, implement, and achieve performance excellence. And we do that by sharing resources, establishing standards such as top-tier award recipient standards and judging standards, and sharing of best practices. Over the last year and a half, we have been resetting our organizational pillars. We want to make sure that we're aligned to what the national program has done with their reimagining initiatives. And so we've redefined our purpose, our mission, our vision, and most recently our core values that also include companion expected behaviors. We're an important entity of the Baldrige Enterprise in that we're considered the entry point for many organizations and communities who want to start to accelerate their journey to excellence. We do try to walk the talk. We have a plan on a page that we update every year to make sure that we have strategic priorities that we're working toward and have a scorecard of operational targets to achieve. You can see here, as we're closing in on the end of 2024, our strategic priorities focused around any changes due to the implications of the Baldrige Reimagine, improving our operational effectiveness, hosting a successful Baldrige Fall Conference, and then we're also looking at refreshing our branding as an alliance. I just want to touch base a little bit on a couple of these. As far as changes due to the Reimagine, there's some tools that we have picked up from the national program that we continue to use at our state and regional programs that are no longer used at the national level. For example, the case study that has been established every year with a feedback report to it. We have developed that now at the alliance level. So we've picked up some of those responsibilities so that we can continue to support organizations as they pursue their performance excellence journey. We also recently hired a part-time administrative person to support our operational needs. We also have a part-time marketing person. And just over a month ago, we hosted a Baldrige Fall Conference in Coral Gables, Florida. It was just a really successful conference, a lot of great networking, learning, and sharing of best practices that took place. We encourage you to mark your calendars for the next Baldrige Fall Conference. That'll be taking place in October of 2025. Dates will be coming out soon. We partner with Communities of Excellence so we can have back-to-back conferences so you can get to attend both of them, and it's going to be in Colorado. So look for info in early 2025 about the exact location and dates for that Baldrige Fall Conference. Additionally, if your organization is looking at getting started on a journey to excellence using the Baldrige framework, please reach out to your Alliance member program. We have member programs that cover all 50 states and territories of the U.S., and we are ready and waiting to help you on your journey. With that, I am going to turn it over to Stephanie.
Well, good afternoon, everyone. It's great to be here, and thank you, Margot. You can go that, actually, I control the slides, don't I? So I'm the President and CEO of Communities of Excellence 2026. And for those of you who aren't familiar to us, we use a Baldrige adapted framework to help improve the quality of life for our nation's residents and communities. And we do this currently in about 26 communities across the country. Our purpose is to ensure that every person in America has the opportunity to live their best life in communities that are thriving. We have a number of current programs, but we have some new programs that we're providing that I'm happy to share with you today. One of the first is an expansion of our digital scorecard. Now, we know, as we heard obviously today, data is everywhere, and sometimes it's hard to know where to start, especially when you are looking at this across sectors and across leaders in a community and trying to identify what your priorities are that you're going to address together. So we've developed the Common Community Scorecard and Toolkit. This is all now digital. It's provided at no cost to communities that participate in our National Learning Collaborative, but we're also very pleased now to offer this to other organizations. So if you're interested in learning more about it, I would encourage you to reach out to us, and you can find our information on our website, or you can contact our good friends here at the Baldrige Foundation. The other program, and you are the first to learn about this, is our newest program called Building Strong Teams for Collaboration. Now, sometimes it's hard to get the right group together to really be able to make impact. We know what we want to do, but sometimes we need to have the right people at the table, and that can be really hard to do. And so this program is really designed to help you establish a cross-sector team in your community and learn the types of skills that you need to be successful in collaboration, as well as provide you with the tools and some of those resources that we know will really help make that work as meaningful as possible. So again, mark your calendar and stay tuned for more details. We're really excited. I know we're out of time, so I am going to now turn this back to Al Faber. And if you're interested in learning about any more of our programs, please visit our website. Thank you.
Okay, well, once again, thanks so much to Susan, Victoria, Bob, Margot, and Stephanie for such an informative presentation today. As a reminder, the Foundation's Institute for Performance Excellence has more than 400 training and professional development certification opportunities offered online and at your own pace. This month, we are showcasing 3 certification courses relating to today's presentation: the Baldrige Performance Excellence Certification course, the Baldrige-based Accelerator, and Healthcare Project Management. You can visit the Institute at baldrigeinstitute.org/education to register and to learn more. As a reminder, the recorded version of today's presentation and slides will be available on the Foundation's website early next week. And once again, thanks to all of our great sponsors and donors, we hope to see all of you again next month when our webinar on January the 16th, 2025, will feature our friends from the Ohio State Wexner Medical Center and will present on Planning to Doing, a framework to drive excellence. Thanks again, everyone, for attending today's presentation, and have a great day.